Hi everyone, welcome back. So today I am going to be talking about sports injuries in teens, and also what kind of sports are good for teens. The different sort of benefits of doing sports in this stage of your life, but also then to look at the types of injuries that are common in teenagers, how they can prevent them, things to look out for, and sort of, when they should be getting sort of extra medical attention, that type of thing. So, I think a lot of parents, we all want our children to, excel and do really well at what they do. But actually, a parent's job isn't to produce, a world championship athlete, but just to encourage their child to become healthy adults and support them in making, fitness a way of life and making healthy choices in their life. We know that teenagers should engage in 60 minutes of vigorous physical activity each day. And certainly I know that as a child, I certainly didn't do that. I wasn't brought up in a family where exercise was really much of a sort of issue, so hence I grew up finding exercise actually quite difficult. So, you start it early and you really, kind of help that teenager to create, a lifestyle for when they're an adult. So as I say, this video will look at the benefits of teenagers playing sports. I'm also going to talk about how puberty can influence sports injuries and how to reduce the risk of these sports injuries and deal with them when they happen. Obviously, all sports have some sort of risk of injury, but the benefit of sport participation far outweighs the risks. And while most teen injuries are due to overuse of the muscle, it's generally contact sports that carry the greatest risk of traumatic injury. So things like your rugby, which is obviously your common school sporting activity. So firstly, what are the benefits of teens playing sports? Certainly it's great, teamwork, building relationships, with other teens, finding a common interest maybe with, other teens that perhaps come from different backgrounds, or communities that maybe, they wouldn't usually mix with. You learn, through the teamwork, you learn cooperation and time management, as well as just sort of keeping fit. You can learn about sports nutrition, which again is one of these lifelong, things that you're going to learn that will really help you maintain a healthy lifestyle for the rest of your life. It can help build leadership skills, which can really boost a teenager's self-confidence. And, positive sport coaching, we know, can also impact on academic success in a positive way. And, if it's something that maybe the parents have an interest as well, it can give teens and parents an opportunity to strengthen their bond, just again through that shared interest. Now, in terms of sort of when a teen is starting out on maybe a sporting activity, obviously there's different types of training. And so it's important for, for any teen to really think about what they want to get out of whatever sport it is they're going to do. So first off, we've got our strength and resistance training. Now, I personally believe that, and it's certainly a sort of widely held belief, that any sort of weight training should not happen until, those growth spurts have taken place. So we'd be talking about late teens here, when the muscles and the bones have really kind of developed. So basically, this strength and resistance training, it's going to tone and strengthen the muscles by working against some kind of resistance, which causes those muscles to contract, and it can also build endurance. Micro tears are created in the muscle during resistance training and are then replaced with new muscle tissue. And, it's this that helps the muscle to become stronger and to, become bigger as well, to, increase that muscle growth. So a couple of ways that weight training can be done. You can use free weights. So that's your things like your dumbbells, barbells, kettlebells. These may require more strength than machines. So choosing an appropriate weight and using a spotter is essential, especially when you're starting out. And just don't start too heavy, because that's how an awful lot of injuries are actually caused. Weight machines. These will usually work a single muscle or a smaller group of muscles. But you've got to know how to use them properly, so do consult with a personal trainer. And then you've got other forms of resistance training, so maybe using your own body weight to provide resistance, something like push-ups, or you can get like resistance bands to give you that resistance. But, as I've said, when starting any new weight training program, you really need to speak with a personal trainer and get some advice. Learn proper technique when lifting weights, and just follow the basic rules. Jog for 5 to 10 minutes, to warm up, stretch after warming up, and then again after doing, the actual weights. Train 2 to 3 times a week maximum for the first few weeks. And if you have to strain to lift, then the weight is too heavy and you're putting yourself at increased risk of injury. You will feel sore after, the first few weightlifting sessions. That's normal. But only work 1 to 2 different muscle groups each workout and allow a day of rest in between for each muscle group after a workout. Stretch and cool down after each workout to reduce the soreness afterwards. And, just also pay attention again to your nutrition, to what you're eating, to make sure that you've got the energy to be doing this workout, and to, make sure that you've got the nutrients so that your muscles can recover from that workout. And if you feel any sharp pain or pops, while exercising, stop immediately and consult either a personal trainer or sports therapist or your GP before continuing. So that is your strength and endurance. The next type of training is your flexibility training. So, flexibility allows movement of those muscles and joints through the full range of motion, and therefore helps prevent, injuries. Stretching should be done before and after other types of exercise, but also needs to be done using the correct technique. And if you want to know more about stretching, you can look at my video on sports massage versus stretching versus foam rollers, which tells you a little bit about the appropriate types of stretching before a workout, and which types of stretching aren't appropriate. And I will also be doing another video on different types of stretching. So do keep your eye out for those. And also yoga and Pilates, and martial arts as well, which is a common activity for children, are, also great ways to improve and maintain flexibility. And these are really things, where it's very easy to just go at your own pace and gradually build up, the flexibility in the muscles. Endurance training. So this is your aerobic fitness, helping with your cardiovascular health. How long, you can perform an activity without fatigue. So aerobic exercise burns calories and fat. It strengthens the heart and lungs, reducing the risk of things like diabetes, heart disease, high blood pressure, all of which, reducing these things will further, improve your endurance again. Now, you can do it so that aerobic exercise is done on those rest days between a strength workout, where you're not doing any weight training. And that way, overall in the week, you're going to get good balanced workout. So good aerobic fitness for teens sounds boring, but, walking, step aerobics, which you can incorporate maybe a bit of dance into, water aerobics, swimming, rowing, running, cycling. All of these things will really help to improve your cardiovascular health. So that's the different types of training that you can do. So now I'm just going to give you some tips for helping to prevent sports injuries in general. And a lot of these, are common sense things, but again, they're things that people quite often ignore. So, we briefly mentioned already about using correct technique. Consult with a personal trainer, get your technique right before you start increasing weights or, increasing the length of time that you're doing, say, and cardiovascular aerobic type exercise. Get your technique correct first. Warm up and cool down, whatever type of exercise you're doing, that will really help reduce your risk of injury. Strengthening the muscles, specific to your sport through conditioning exercises. So, for example, if you're, say, doing, throwing events in athletics, things like your discus and your javelin, well, running on a treadmill probably, yeah, sure, it'll be great for your cardiovascular health, but it's not going to do much to help warm you up for those throwing exercises. Increase your flexibility through regular stretching. Don't overtrain, It's very easy to get really enthusiastic when starting any workout, but if you go in there all guns blazing, and sort of straight into really long workouts, the likelihood is you're going to regret it. So just build up gradually. Wear the correct footwear. So many people, running in particular, they're wearing some old pair of trainers that doesn't really support the foot very well. And again, that's going to mean that you're getting a higher impact through certain joints and you're going to be prone to, more injury. Make sure that you use, if there's any safety equipment that you should be using, make sure that you use the correct equipment. So things like, for example, American football, there's a lot of padding, helmets and, maybe shin pads, that sort of thing, mouthpieces, face guards, protective cups, things like that. Just make sure that you use them because they're there for a reason. Always follow the safety rules of the game. Ensure that, again, we've talked about nutrition, ensure that you have balanced sports nutrition to maintain the blood glucose levels, before, during and after sports, which is what's going to give you your energy. Do not fast. So many people talk about, oh, you're fasting, it's so great for you. But, if you're doing sports, fasting is not a great idea. Ensure adequate hydration. The body loses fluid during sports and can dehydrate, which will then affect your fatigue levels, and really put you at an increased risk of injury, because if you're dehydrated, then your technique is probably going to suffer. Take at least one day off a week to allow the body to recover. That is important. And I'm also, the other thing is, you should consider, sort of, if you're going through puberty, there's a rapid growth spurt here. So there are some considerations to take into account, which I'm going to go on to talk about in this video. And the most important thing of all is, do not play if you are in pain. It's so easy, to get in that competitive spirit, or, to feel like if you're in the gym doing weights that, you should be able to push past and, do a little bit more. But actually sometimes, no pain, no gain is not a great thing, to sort of live by with sports. And if you're in pain, the likelihood is that's your body saying you need to just take a rest, because at the end of the day, if you push past it, you might do yourself a bigger injury, and then you could be out of the sport or the gym, for months. So listen to your body. Okay, so now I'm going to talk about the types of sports injuries that you might see. So we've got acute traumatic injuries. So these are things like fractures, sprains, strains, concussions, cuts, usually due to a traumatic blow in a sport such as football or rugby, where you've got a tackle, or potentially even wiping out while skateboarding. Then you've got your overuse injuries, which are chronic injuries that occur over time. And this is usually due to repetitive movements. So it can be things like stress fractures or tendinitis, which may occur in things like throwing sports. So now there are common injuries that tend to occur more in teens. So I'm going to talk about those now. So the first one is groin injuries. Teens have an increased risk of stress fractures in the groin, particularly teenage girls. And there's also an increased risk of avulsion fractures in teenage athletes. And this is really due to the pelvic growth plates not having yet solidified. These are common in, again, sports such as football, rugby, where you're going to have a tackle, hockey, basketball, and also gymnastics. Any sports that involve sudden stops and starts, you're going to get an impact through, those adductor muscles in going into the groin. Ankle sprains are also a common one, probably one of the most common injuries. So this is basically a twisting injury that damages the ligaments in the ankle. These will require a brief period of immobilization, followed by an exercise program, and a short rest from the sport. In younger athletes, the non-displaced growth plates, fractures of the fibula, which is in the lower leg, it's the smaller bone. Fractures of that can mimic an ankle sprain, so that's just something to be aware of. Another common issue in teens is knee pain. Now, anterior knee pain is common in youth sports, particularly again in females. There is something called patellofemoral syndrome, which is considered to be an overuse injury due to overloading on that kneecap at the front there. It's often due to some sort of muscle imbalance and also high activity levels that we see in teens. But physiotherapy will treat this condition, or again, you could have like sports massage. Shin splints, which is basically inflammation of the tendons that connects the shin muscles to the tibia, which is your shin bone. And this inflammation arises due to overloading of those muscles and tendons. Then you've got something called Osgood-Schlatter, which is a very specific type of knee pain. This is a traction injury on the apophyseal growth plate at the top of that shin bone, due to strong and relatively tight muscles, which develop during puberty and again high activity levels. You'll usually get pain, and sometimes swelling can be felt directly over a bump at the bottom of the knee. Treatment, rest, stretching, ice, anti-inflammatories, possibly a knee support, and then maybe some physio or sports massage again will help. That will really just help to reduce the tightness in those muscles, but that would probably only be advised once the pain has subsided. Now, another common knee injury in teens, one that I can definitely sympathise with, is your ACL tears or your anterior cruciate ligament. So the anterior cruciate ligament is basically there to stabilise the knee. And it's usually torn during some sort of uncontrolled twisting movement. It almost always requires surgery in young and active people. In adults, surgery isn't always recommended, but for, teens and those who are really active, still maybe developing, surgery would definitely be recommended. It can often involve damage to other structures of the knee, for example, the menisci, which are those shock-absorbing discs of cartilage in the knee. And it's becoming much more common, actually, in teens. And this is thought to be due to the early participation in sports such as football, where, again, you've got those sudden stops and turns that puts, more impact on the knee. If you have an ACL tear, it's really important to wait at least 7 to 9 months before returning to sport. Because if you go back to the sport before then, you're not allowing, the healing to take place properly, and you're really going to increase your chance not only of a permanent weakness in that knee, but also of increasing the risk of injury in general, because other muscles will then start to compensate for, the weakness of that knee that's not quite healed properly. Okay, so that's the knee. Then you have an injury called little leaguer's elbow. This is considered a classic overuse injury, and it can include pain around the elbow during excessive throwing. You can recover with rest, stretching, and proper throwing technique on return to the sport. In some cases, it may require surgery, but not always. And so this is going to be common in things like baseball or any of those, throwing activities, maybe javelin or shot put, that type of thing. Shoulder dislocations are also a common injury in teens. Teen males playing contact sports such as, again, football, rugby, where you've got this, all these tackles, are one of the biggest risk factors for a shoulder dislocation. And I will be doing a video in the future on shoulder dislocation and the different types, and what you can do to sort of work on the muscle afterwards. So you can always subscribe to my channel and you'll be notified when that comes out. Foot and ankle injuries. Now, anyone who has flat feet, high arches, or any other sort of anatomical foot differences are going to be susceptible to sports injuries. And so this is why, again, it's really important to wear, the correct shoes, that are supportive to the feet. If you've got flat feet, wearing, like an arch support in your shoes, that type of thing, if you're doing a lot of running, will really help reduce your risk of injury. Head and neck injuries. Again, these are the most common in those contact sports such as football, or even sports with a risk of falling. So horse riding is another common one. Any impact or shaking of the head, we know, can cause concussion, contusions, fractures, or even hematoma, which is like a collection of blood. Neck injuries such as whiplash or strains, sprains, fractures, these can occur with sudden jerking movements of the head. So, if there's any kind of head or neck injury, or impact to the head, falling on the head, the person must not be moved until medical help arrives. Okay, so then we've got our hand and wrist injuries. So anything where you're going to fall onto an outstretched arm, or that forces the hand or fingers backwards, a direct impact can cause these injuries. So usually we'd again be talking contact sports such as rugby, where you're tackling. Saying that, I actually fractured a finger in netball when I was a teenager, just because the ball landed straight down and it snapped back the other way. Gymnastics is also known for hand and wrist injuries. And again, this is going to be because of the chance of falling onto an outstretched arm. Back injuries. So these are usually caused by overexertion of back muscles during bending, twisting, or any kind of lifting movements. So these are going to be much more likely in sports. Again, those contact sports like rugby, wrestling, sometimes golf, because you've got that twisting movement. And again, gymnastics. Then you've got sex organ injuries. Now, these will affect males more than females, and really just due to the organs being more exposed and external rather than internal. And again, this is where I go back to saying, make sure that you are using any, safety equipment like a protective cup That's really important. But saying that they often affect males more, actually in girls, breast injuries are, quite common. And this is because a collision, again, is going to be more painful because they're on the outside. And, certainly if breast development causes tenderness anyway, or you're getting tenderness around the time of your period, this is one to watch out for. So that's the common injuries that tend to occur in teens. Now, I'm just going to talk about the more sort of, maybe the sort of not so physical aspect of sports injuries. So I want to talk about sports related emotional stress, because this is something that's often ignored. Many coaches and parents place so much focus on the winning rather than the effort that's being put in and the sportsmanship. And this can really place teens under a considerable amount of pressure. The main goal is to have fun and to learn a lifelong physical activity, and something that's going to help you, keep a certain level of health and fitness through adulthood. So, it's important to just remember that, and just, as parents, to ensure that your teens, don't put everything, the whole focus onto winning, or feel like a failure, if they lost a match, for example. Okay, so I now want to talk, we've mentioned a little bit about concussion, and so I want to talk a little bit about sports-related concussion. As we've said, all sports carries some kind of risk, but certainly sports such as football, basketball, hockey, rugby, even cheerleading, have a higher incidence of concussions. Some of which can be avoided through safe techniques and following the rules, but sometimes it's just one of those things that happens. Now, head injuries should never be ignored, and if, one or more symptoms of concussion are present, then sport should definitely be avoided and medical advice be sought as soon as possible before even thinking about going back to sport. Athletes should also reduce their physical exertion and cognitive workload while recovering, and this can take up to 4 weeks. So, but as we've said, all things considered, the risks of injury, are far outweighed by, the benefits of sport. Aside from having fun and staying active, playing a sport can help you, help teens and children to develop these leadership skills and self-confidence and teamwork, which, will help them deal with successes and failures in life. And also by participating in sports, children, often find exercise enjoyable and, as we know, are more likely to establish lifelong, exercise habits. So now, I said that I was going to talk about the effects of puberty on sports performance, and sort of what parents need to know, really. So, it seems to be more common now for children to specialise in a single sport from an earlier age and actually train like all year round, which, may benefit long-term or, career or college goals. But actually, it has been suggested by paediatricians that specialising in one sport shouldn't happen before puberty, when teens go through a growth spurt. And this can, affect their athletic performance. Now, Increased muscle size and strength and hormones can all boost athletic performance, but height and weight increase may temporarily affect balance and the centre of gravity during the growth spurt, which can then lead to injuries. It can mean that a teen may appear to be a little bit clumsy, particularly in sports such as basketball or gymnastics, which require balance. But even sports such as tennis or lacrosse may be affected just by changes in arm length. And again, it's just that sort of spatial awareness if you've had a sudden sort of increase in growth. With regards to the growth plates, children's bones contain a cartilage growth plate which turns into bone once fully grown, and so this growth plate is always at its weakest during a growth spurt. If fractured by a fall or excessive impact, or maybe if it's subjected to repeated stress, the bone may not develop properly. And this is another reason why we say, sort of teens shouldn't be starting like any kind of weight training until they're sort of in their late teens, when these growth spurts have already taken place and, that bone has developed. Even a gymnast who has had no injury may suffer just from repetitive, tumbling. That can still have an impact. Now, we talked a little bit about ACL tears. The ACL ligament, it's at increased risk of injury once a teen goes through puberty and becomes taller and heavier. So we're talking approximately age 12 to 13 in girls and about 14 to 15 in boys, potentially affecting the stability of the knee. Now, another thing is that teenage girls use their muscles differently to boys during jumping and landing, and they don't have that increased muscle growth that comes with testosterone in boys. And so they're going to be at increased risk of ACL tears. The other thing to consider with puberty is whether or not, you're an early or a late bloomer. Particularly for boys who, as we've said, have that testosterone and so have that muscle growth a lot more. Sports teams tend to group kids by age rather than development. And since not all teens go through puberty at the same time, their physical capacity and motor skills will not be matched evenly. 25% of height development in puberty sees a risk of injury increasing, during this growth. A late bloomer, may have the appearance of a 10-year-old when they're 14, could be potentially tackling an early bloomer of the same age, but who has the appearance of a 17-year-old. There's going to be safety issues there. It's not only the late bloomers either who are vulnerable to injuries, because early bloomers may then be selected for sports because of their height, but their bones are still developing. So, if they get tackled, they're probably going to be at increased risk of injury compared to someone who is that little bit older and who, whose bones are pretty much developed. So again, in these cases, safety measures once more are so important, ensuring that these protective items such as shin pads, helmets, mouth guards, protective cups, shoes all fit correctly. Coaches should enforce strict rules against actions that could, encourage head, neck, spine injuries. So things such as head first sliding in baseball, or head first hits or banned tackles. These are things that teens should be made aware of, and absolutely they should be penalised if they're using these. Setting an age restriction on particularly high-risk sports such as ice hockey, to allow for body development during puberty. Injuries may also be more likely in co-ed, particularly in contact sports. Although I think generally in senior schools, it tends to be, boys and girls sports tend to be generally separated, so that's not too much of an issue. But, obviously, again, that would be, the increased injury risk there would be due to that higher testosterone in boys, which makes them stronger than girls of the same age. Now, while an early bloomer may be at an advantage because of their size, progress in sports should be based on correct skill and teams matched equally in terms of development. But unfortunately, the emphasis that the coach places on winning means, this doesn't always happen. And late bloomers, on the other hand, may be sidelined due to a lack of ability early on, meaning that they then feel incompetent, they lose confidence, and they give up sports altogether, which is a shame. And, it can affect them then, going on into adulthood in terms of maintaining a healthy, fit lifestyle. Okay, so now I'm going to we've talked about the injuries, and I want to talk about when you should see a doctor. Many overuse injuries, such as tendinitis, will happen over a period of time, and usually won't interfere with playing, which can often cause a delayed diagnosis and delayed treatment, which means that the injury worsens, and can potentially become something more serious. So, basically, see a doctor if you have point tenderness over a bone, if the pain is really bad, or worse when you're active, if the injured area is swollen, if you're limping, or if range of motion is limited, if pain continues for a week or more following injury, or the symptoms don't go away after rest, any condition, that affects your training, all of these things, it's best to seek medical attention. So types of injuries, so acute injuries, so here we're talking things like the sprains, strains, fractures, dislocations, separation of growth plates, torn cartilage, pinched nerves, herniated discs, anything like that. You're going to get pain, swelling, bruising, possible deformity, spasms, restricted or maybe a locking joint, instability of the joint, numbness, tingling, shooting pains, any symptoms that restrict sports or even daily activity. You want to see a doctor if there is joint swelling, locking, or instability, if there is visible deformity in the arm or leg joints, if there is inability to fully move a joint or inability to stand and walk, if you have back pain or neck pain, especially with numbness and weakness, or a pain that runs down the arm or the leg, any pain that doesn't go away, or pain that disrupts daily activity or sleep, you want to go and see a doctor. In terms of the overuse injuries, so things like tendinitis, shin splints, stress fractures, growth plate problems like Osgood Schlatter's, little leaguer's elbow, bursitis, fasciitis, compartment syndrome, nerve entrapment, anything like that, where you're getting symptoms of pain, tightness, popping, grinding in the joints, maybe mild or localized swelling, weakness, symptoms that get worse with activity but go away with rest, where symptoms are initially noticeable, after vigorous activity, but, then kind of come about gradually during, any activity. With these type of injuries, you want to see a doctor if the localized pain worsens over time or with continued activity, if the pain, swelling or stiffness or weakness interferes with training or interferes with daily activities or disrupts sleep, and if you have pain or other symptoms that don't go away with treatment or with rest, then that's the time to go and see a doctor with these type of injuries. Now, I also want to talk about medical conditions that, can be affected by team sports. Concussion, we've sort of mentioned briefly. So symptoms of concussion would be headache, disorientation, dizziness, vomiting, maybe loss of consciousness, blurred vision, sometimes memory loss, agitation, general moodiness, and sort of, fatigue. If any of these symptoms develop after a head injury, you need to see a doctor before returning to the sport. And precautions should also be taken with conditions such as fever, abdominal pain, heat stroke, or, any kind of dehydration. You want to just kind of really keep an eye and potentially check with a doctor. So, in terms of going back to sport, rehabilitation may include exercise, manual therapy such as physiotherapy or sports massage, possibly ultrasound or other technology to help relieve pain and promote healing of those tissues. You may need new protective gear, maybe athletic tape to protect the injured body part, and just provide extra support. You want to make sure that you warm up adequately before practice, and just take it slow and gradually build back up to your pre-injury level. Know your limits. And, as I've already said, if anything hurts, if you're getting pain, stop immediately. Don't push through the pain. Listen to your body, know your limits, and, that way you can help avoid, your sort of injury that you've just had turning into something worse or, developing another new injury. But when the question that you need to ask also is, when is the athlete ready to return to play? So this is going to be dependent on a few factors. So one is diagnosis. You've got to determine the cause of the symptoms. Why did the injury take place initially? Treatment options, recovery time frame, Is there a standard amount of time that you should be resting? An expected level of recovery. How does the condition affect your performance now? Will it interfere with the athlete's ability to play, or will it adversely affect endurance or flexibility or strength or maybe coordination? Because if it's affecting any of those things, you may need to just take time out for a bit longer, or possibly just adapt, what sport you're doing. If you go back to play, will the condition get worse? The injured body part may become more vulnerable because it has been injured. And certainly ACL tears are a classic example of this. So if return to play happens before a full recovery has taken place, the injury is likely to get worse. So for example, a stress fracture can then become a complete fracture, which is going to need a whole lot more time out. So sometimes it's good just to be a little bit more patient, take a bit more time, because in the long run, that will be a lot better for you. Also, you should ask yourself, what is the risk of secondary injury? Sometimes when athletes try to protect an injured area, they can then expose other parts of the body to injury, or other, muscles will start to overcompensate for that injury site. So, it's important, to be able to use that joint or muscle, to a pretty sort of good level before going back. If you've had treatment for an injury, has it been effective? One, not only is there treatment available, but has it been carried out? Has it been effective? Are there any side effects of the treatment? Has the treatment finished? And have the, deficits from the injury been restored? Are you ready to go back? If you are going to go back, can the sport or the level of participation be modified to ease you back in gradually? So, for example, maybe you can temporarily play another position without jeopardizing recovery, or you can reduce the hours of practice, or maybe you can modify the technique or the equipment used to, allow yourself to continue to play. Also, if you're playing for a sort of a club, are there published guidelines that they have, that address return to play after injury? Is there going to be also a disproportionately high risk for further injury? So, if the injury further increases, high risk of maybe contact or endurance sports, it may not be the best idea to play. And also, informed consent has a part in this. Return to play shouldn't take place until that athlete understands all of the risks involved and considers those risks to be acceptable, not only for the athlete to consider them to be acceptable, but for the parents and for the doctor and the sports coach to see them as being acceptable. And probably the most important one of all is, does the athlete want to play? Because sometimes after an injury, athletes may not want to return to the sport, maybe through fear of further injury or concern that they won't play as well and maybe they'll be letting the team down, or they might just lose interest. They might just experience burnout. Then they shouldn't be pressured into it. And this goes back to when we were talking about the emotional stress, and sometimes pressure placed on teens, either by a sports coach or by parents, and at the end of the day, it really has to be the teen's decision, whether they want to go back, because at the end of the day, it's them that's, going to face any injury, further injury risks. So quite a few considerations there, not only for you teens out there who are either in a sports team now or considering taking up a sport, but also for, you parents and even sports coaches out there. You should be aware of all this. So yeah, just some things to consider. As always, I will have further videos coming out, particularly I've got a lot coming up on sports injuries and specific muscle groups. So you can subscribe to my channel if you want to be kept informed of those. And do contact me, comment down below. You can contact me through my Facebook or Instagram with any questions that you might have, and I will do my best to answer them. But for now, that is all from me. So, stay safe when you're doing your sports, and parents, try not to put too much pressure on your teens. And in the long run, you'll be really helping them to maintain a fit and healthy lifestyle. So yeah, that is all from me today. So take care, and I will see you next time. Bye.